Constipation is one of the most common reasons that parents bring their children to the pediatrician. The good news, though, is that in most cases, it can be well managed once we figure out what's causing it. Hello and welcome to the Dr. Amaka Nnamani Show, where we prioritize preparation over perfection. So let's get into it. What's constipation? Constipation is a condition where babies, infants, toddlers, older children, and even adults have a change in their bowel movements. So it may be a change in the pattern, a change in the frequency, or a change in the consistency of their stool. So what I mean by consistency, it means that maybe a child who would have a normal, soft, pasty maybe bowel movement may start having hard pellet-like stools. That is constipation. So there are different reasons for this, right? And we'll start from the newborn period and kind of work our way up, okay? So if you've watched my earlier videos around the newborn period, you would have learned that most babies need to have a bowel movement in the first 48 hours of their lives. So that's usually when your baby is passing meconium. Meconium is that black tarry stool that is really the first poop that your baby passes, right? And then that's really important because the hospital will likely not discharge you or your baby, if your baby has not passed meconium. It's really important because we want to make sure that your baby's anus is patent, is open, and that your baby is actually able to pass stool, right? And so it's really important that that happens. And if that doesn't happen, then actually that's the beginning of a workup in the newborn period. Now, most babies are fine and pass meconium and go home. I always want to share that most babies actually may not have a bowel movement for up to 3 or 4 days, and that's normal. That may just be their norm. That is not necessarily constipation. That may just be your baby's normal bowel movements. Importantly, a lot of babies who are breastfed may actually go up to 3 or 4 days even without having a bowel movement. Now, if your baby is having a bowel movement mostly every day, and then there is a change in the pattern, we typically would call that constipation. Again, in the newborn period, it could be as a result of a change in nutrition. So if you've had a baby who was exclusively breastfed and maybe mom's transitioning to formula, that could be a reason for constipation, right? And in that case, I usually would recommend that you speak to your pediatrician because your pediatrician may want to do what we call a rectal stimulation to make sure there's stool in the rectal vault in the anus, and or may prescribe prescription medicine for your baby. Very importantly, do not give gripe water for constipation or hiccups. Babies in the first 6 months of life do not need any fluids besides breast milk and or formula. And so giving water can actually cause electrolyte disturbances, so we never really want to offer that, okay? So if your baby, is otherwise having normal bowel movements, and there's a change, like I said, call your pediatrician if it's been more than 4 days. Now, in babies 6 months and up, you can actually offer certain foods, right? I call them the pea fruits. It's really important to know that what you poop, right, is really a factor of what you eat. So there's this thing that goes garbage in, garbage out, right? So you really want to think about your child's diet and your diet, right? If you're an adult maybe watching this. So we really want high fiber foods. High fiber foods are fruits, vegetables, and just other foods that have high fiber content. So importantly, the pea fruits, I call them, tend to have higher fiber than most of the other fruits. And those are apples, pears, prunes, peaches, right? Peaches. Okay, so yeah, I have a silly moment there. But yes, you can offer those fruits to your baby, right? So for an infant that's like 6 months of age, you can give a modified form of it. So you can mash it up and then offer it to your baby. A lot of times that will help your baby have a bowel movement. But if it's been more than 3 to 4 days and your baby has not had a bowel movement, please call your pediatrician for further evaluation and management. Again, in the infant stage, you can actually do bicycle movements, right, to just help release the gas. And a lot of times, actually simulating your baby being on a toilet seat will help, making sure to stabilize your baby's head and just putting your baby between your legs to almost simulate your baby being on a toilet seat. A lot of times, gravity will actually help that. So I've seen that be very helpful, again, in the infant time period. Now, with your older children, right, who are now mostly on table foods, the most common cause of constipation, like I just shared, is a poor diet, right? And so modifying your diet, making sure to remove foods that are ultra processed, basically things that you are having to read lots of ingredient labels for. A lot of times those are not healthy foods, right? And making sure you're drinking a lot of water. Your body has a high percentage of water, and so it's important that you drink at least 8 tall glasses of water a day, right? And this will usually help to get things moving. Now, in your older children, a lot of times the next time we'll see issues with constipation is usually when you're trying to potty train your child, right? So maybe right around the ages of 18 months and 3 years. And you may have children who start to withhold their stool. Maybe they've had a bad experience, or they were scared pooping in a big girl toilet or big boy toilet. Maybe they strained and then they get scared and then they start to withhold it. That is usually one of the most common reasons. In that case, I usually recommend pausing toilet training and allowing your child to be in their diaper, right, for at least 2 weeks. You can continue to read books on potty training to them, but it's important that you just kind of take a break, especially if there's other stressors in the family, whether it's a family transition or even the birth of a new child. And with that, when you restart, and or if your child is an older child, having a toilet regimen. What do I mean by that? That just means that you can train your body to poop at about the same time every day, and it does work, right? What does that look like? So choose a time of day that works for you. A lot of times it's usually around after dinner time in most families. So I say pick a time that works for you. If it's lunchtime, just make sure it works for you, okay? So offer after dinner, give a glass of water. 10 to 15 minutes later, have your child go sit on the potty, right? If they're sitting on a big girl or big boy potty, have a stool underneath to just help with the pressure and gravity, and then just have them sit in the toilet seat for about 2 to 3 minutes. Try not to have them actively think about pooping. So a lot of times I'll have my parents read a book to their child or have them sing a song, just so that they're not actively thinking, oh, am I gonna poop now or am I not? Continue to do this most days of the week, and eventually your body will start to realize, oh, it's 5:30, time to poop, right? And this actually does work. Now, if after trying these things at home, cleaning your diet up, offering high fiber foods, drinking a lot of water, and these things do not work, please call your pediatrician. Other red flag signs to look out for is if there's associated abdominal distension, so your baby's belly looks big, right? Or your child is nauseous. When I say nauseous, I mean feeling like they're gonna throw up but not actually throwing up. If they actually throw up, and or if there's stools in the poop. Constipation oftentimes can be associated with just, a minor fissure. So maybe because they're straining and they can have a little tear, but there are other things that can cause bleeding. So if you're seeing gross blood in the toilet bowl or in the stool, that is a red flag, and you absolutely wanted to have your pediatrician check it out, right? So we've talked about a few things in this video. We've talked about what constipation is, when to worry, right? The common causes of it, especially in the newborn period, in the infants, older children, and even adolescents, right? In adolescents, a lot of times it's just a really poor diet, right? And then some remedies to do at home and what not to do, like no gripe water. If you don't remember anything else from this video, please, especially in your babies, your newborns in the first 6 months, do not give that. And then making sure to call your pediatrician if there are other associated symptoms like nausea, vomiting, fever, abdominal distension, and or extreme discomfort. I hope this was helpful. If you have any questions, put that in the comments. Let me know your thoughts of what was most helpful for you. And until the next video, bye-bye. Remember, preparation over perfection. Toodles.